HAS-BLED Bleeding Risk Scale. HAS-BLED is a scale used for assessment of the risk of bleeding in atrial fibrillation. The HAS-BLED scale allows you to assess the risk of major bleeding in atrial fibrillation. By major bleeding is meant any intracranial hemorrhage, bleeding requiring hospitalization, accompanied by a decrease in hemoglobin, or requiring blood transfusion. The HAS-BLED is recommended to identify the high-risk patients or regular review and follow-up to address the reversible risk factors for bleeding. The HAS-BLED score is based on these parameters: arterial hypertension, systolic blood pressure greater than 160 mmHg, abnormal or impaired liver function, abnormal or impaired kidney function, stroke, bleeding history or predisposition to bleeding including anemia, LA-BLINR, elderly age more than 65 years old, alcohol abuse or taking medications that increase the risk of bleeding, for example, antiplatelet agents, aspirin or non-steroidal anti-inflammatory medications and SAIDs. A score of 0 to 2 indicates low risk of bleeding, and a score of greater than 3 indicates high risk of bleeding.